plano po na gawin ngayong taon. Next slide, please. But before that, let me give you a brief measles situation and the risk of measles outbreak here in the Philippines. Next slide. This first slide tells you about the measles incidence simula pa noong 1997 up to 2020. Also, in this slide is the routine immunization coverage for our measles-containing vaccine 1 na binibigay natin at 9 months and the measles 2 which we give at 12 months, as well as the different supplemental immunization activities for measles conducted since 1998. In the past, kung mapapansin ninyo, we conduct supplemental immunization activities regularly every 3 to 4 years. And let me take your attention to the 2004 SIA. This is the most successful supplemental immunization activity for measles conducted in the country, in my opinion. Not only because we reached the 95% target, but also this SIA was able to control the measles transmission, and we were able to bring down the incidence of measles for several years to a significantly low number. And this actually is the sole purpose of a supplemental immunization activity to prevent outbreaks. Next slide, please. Now, the last outbreak we experienced was in 2014. Kung makikita ninyo, more than 54,000 measles cases were reported during this outbreak in 2014. Another outbreak year is 2018. More than 20,000 measles cases were reported in 2018, and despite the outbreak response immunization that we did in 2018, measles transmission continued until 2019. You can see here in the Philippine map that around it's fiery red. So more than 48,000 measles cases were reported. In the first 3 months of 2020, we still saw some clustering of measles cases in some of the regions, and a limited outbreak response immunization was done in these areas with measles clustering. Next slide. Now, this slide will tell you the incidence of measles in 2018, 2019, and 2020, as well as the different outbreak response immunization that we did in the past. So 2018, 2019, the DOH conducted several phases of outbreak response immunization targeting different age groups. Our first priority are the 6 to 59-month-old infants and children. The second priority are the school-age children. And the third priority is the older age group. In the first half of 2020, first 2.5 months of 2020, we saw a small peaking of measles cases in selected regions. And as I have mentioned earlier, we did a limited outbreak response immunization in these outbreak areas. And after confirmation of the COVID-19 cases in the country and thus establishing the local transmission, thereby we implemented a stringent lockdown, we noted now a decline in the number of measles cases. Now, as for the reason of this decline, I would like to think that the several rounds of the measles outbreak response immunization that we did since 2017, 2018, 2019, and 2020 helped control the measles transmission. However, we are not discounting the probability that the COVID-19 pandemic, which significantly limited our surveillance officers in the field, also limited the active case finding and specimen collection and testing, were not optimum at this time, leading to this low number. But I think the SIAs and the outbreak response immunization contributed much to bringing down the number of measles cases. Next slide. Okay, so this is the measles immunity profile for 2020. When we do analysis of our measles report, we take into consideration the immunity given by our supplemental immunization, immunity from routine immunization, also immunity from maternal antibody, as well as natural immunity, because once you get measles, you are immune from contracting the disease again. So this is the measles immunity profile. I apologize, this is very technical, but suffice to say that for 2020, more than 2.4 million children under 5 are susceptible for measles infection. So this is what we want to prevent. Next slide. Now, another analysis that we did is the measles risk assessment by province and city. We took note of the 2019 SIA coverage, the 2019 surveillance performance, also the immunization coverage from the supplemental immunization from 2017 to 2019, and where is the risk? If you can see in the Philippine map, everybody is at risk because all provinces and almost all cities are high risk for measles. That's why, next slide please, we are planning to do a campaign in 2020 and 2021, but of course, we also have to take into consideration the COVID-19 transmission. So this table will tell you alin yung mga top areas, both for measles outbreak, as well as those with high burden of COVID cases. So nasa top 5 tayo, NCR, 4A, Region 3, Region 6, and also we have Region 10 as the top cases for regions with COVID cases. And then down the line, you have Region 7 as well, who is a very high-risk region for measles. Next slide. Now, I think most of you saw these dolls. And I have mentioned in my previous presentation that this is now the polio situation in the country. To date, we have 27 polio infection. When we say polio infection, ito yung mga bata where samples from them were taken and they tested positive for CVD-PV. Now, 17 out of the 27 are polio cases, meaning these children have disability because of polio. Next. Next slide, please. So, national action in preventing measles outbreak. If I can have my next slide. So, this is now the plan, because still, in 2020, we haven't controlled the polio outbreak that was declared in September 2019. We still haven't controlled transmission of VDPV. Therefore, because we have two problems now, high risk for measles outbreak, most of the provinces and cities, outbreak, a big outbreak is predicted in 2021. This is now the plan of the Department of Health together with the local government units and partners. The plan is to do a nationwide MROPV supplemental immunization activity. Now, this is very critical, to be conducted this year in some of the regions with very high risk for measles outbreak. It's very critical that we do this now because, as you have seen, the cases of measles in 2020, last quarter, has been going down. So this supplemental immunization activity, in the true sense of the word, is going to prevent the future outbreak. We don't want to respond to an outbreak, but we want to prevent an outbreak. Thus, the supplemental immunization activity. The phase 1 will be conducted malapit na, October 26 to November 25, 2020 in selected regions in the country. These are your green ones. For Luzon, we have all of the regions in Luzon except NCR, Region 3, and Region 4A. And all of the regions in Mindanao will do the national or the subnational MROPV-SIA in October 26 to November 25. Phase 2 will be for the rest of those regions not included in the phase 1, and this is tentatively scheduled in February. I'm sorry, there's a typo here, February 2021. Now, eligible target children, if I can have my next slide, please. Since this will be conducted in 2 phases, for the phase 1, around 4.3 million children are targeted to be vaccinated for measles, and for BOPV or the bivalent OPV, 2.1 million children. Bakit mas konti doon sa polio? Because the regions in Mindanao who have done series of sabayang patak kontra polio in 2019 as well as during the early part of 2020 will no longer give the polio vaccine to the under 5. But the polio vaccination will be given to the targets 0 to 59 months in these mentioned areas in Luzon. So for phase 2, it's gonna be next year, 2021, and the participating regions or implementing regions are the NCR, Region 3, Region 4A here in Luzon, and the regions in the 3 regions in the Visayas. So 4.7 million children is targeted to be vaccinated for polio in 2021, and 5.1 million children are targeted to be vaccinated against measles and rubella for the rest of these regions. Next slide, please. So we have been saying that in order to control an outbreak, prevent an outbreak from happening, and stopping transmission of vaccine-preventable disease, DOH cannot do it alone. We need a whole of government, whole of society approach. This is actually our lesson when we did the Sabayang Patak kontra Polio in Mindanao. It was a successful campaign because all of the stakeholders came together. We moved as one. We moved forward in one direction towards controlling polio transmission and polio outbreak. Next slide, please. Essential to success of a campaign. We have several: emergency preparedness, technical and program preparation, advocacy, systems preparedness, social preparation, vulnerable communities, troubleshooting system. And all of this has to be a strong component. You can see here that we are as strong as the weakest link. So we want to be prepared for the success of this campaign in 2020 and also in 2021. So we need to have a good planning as well as coordination with all of the stakeholders. Next slide, please. And as for our next step, we also coordinated with the interagency task force, and we got a recommendation, an endorsement from the Interagency Task Force in the conduct of the measles, rubella, and oral polio vaccination uh, in 2020 as well as for 2021, because we need to move forward. We need to control the outbreak for polio, and we also need to stop the measles outbreak that is predicted to happen in 2021 if we will not up the coverage. So I think this is my second to the last slide. If I can move forward to my last slide. I call this the measles importation slide. So when this will be shown in conferences, uh, as a program manager for the expanded program of immunization or the national immunization program, it is not a very pretty slide to look at, because it tells you that your country is the biggest exporter of measles in 2018 to 2019. We want to put a stop on this. That's why it's very critical that we do a quality campaign for 2021 as well as in October 2020 to stop measles from happening in future month and in the next year. And we will not be exporting measles when travel is already allowed. Now, as a last note, I want to enjoin everybody to please support the measles, rubella, oral polio vaccine supplemental immunization activity, and to spread the word. Make it a table conversation that vaccines and vaccination is the only way to go to prevent the vaccine preventable disease outbreak. With that, thank you very much and maraming salamat po for listening.
Thank you, Dr. Wilda, for that very comprehensive presentation. We will now be moving on to the question and answer portion of the media forum. Let's start with Mr. Red Mendoza.
Hi, good morning po, Dr. Wilda. Nice to see you back again po sa ating media forum. Doc, you said po na every 4 years ang immunization program. So does this mean po na parang every 4 years there's always resurgence sa measles cases? And last question po on my end, I saw po the IATF resolution that basically allows the government to do the immunization program. So are we expecting more health workers na po on duty na po sa mga health centers and community clinics natin to supervise and to para mag-ikot po sa ating mga bata to do the immunization program, which you say will happen from this year until February?
Okay. Maraming salamat, Red. Regarding the conduct of the supplemental immunization activity, kung mapapansin ninyo, this is a planned activity because we look at the coverage. Unang-una kasi we're guided by the administrative coverage. Ilan yung nababakunahan, ilan yung namimiss, ilan yung defaulters na tinatawag natin, at ilan yung gumagawa ng catch-up vaccination, kumbaga yung mga outreach vaccination na ginagawa natin sa ating mga local government units. Now, if we do not have a good number, nag-a-accumulate yung ating mga hindi nababakunahan, therefore vulnerable to get the measles infection. And also, we are guided by our disease epidemiology surveillance. Kung nakakakita tayo na may mga pockets of measles transmission or clustering of measles sa isang lugar, then we do either a small scale or a limited response outbreak immunization. But sinasabi ko nga, yung supplemental immunization kasi ginagawa natin every 3 years or 4 years, depende po sa analysis na nakikita natin sa mga datos na dumadating sa atin. I have shown in the slide the measles risk assessment as well as the measles analysis na talagang ginagawa po not just in the national but also in the regional level sa mga CHDs natin. Yes, kung titignan po ninyo, may cycle talaga. Pero yung cycle kasi, pwede nating i-break kung mataas yung population immunity. Because if you will look at if you will review my slides kanina, makikita natin na bumababa kasi yung coverage, so tumataas na yung kaso natin. That is when we try to do either outbreak response immunization or we plan for a supplemental immunization because we don't want to respond to an outbreak. Kasi pag may outbreak, naghahabol ka na. And measles virus run fast. So kailangan we run faster. So ayaw natin yon kasi masyado na tayong nagagahol sa oras, and we don't put also our children at risk, and the risk of dying is there because measles is highly contagious, and complications from measles, particularly pneumonia and diarrhea, yun yung nakakamatay sa ating mga kabataan. So yes, my answer is that depends on our coverage, the outreach, as well as the defaulter tracking. And also, we are guided by the disease surveillance. That's why there is irregular conduct of a supplemental immunization activity. Now, for your second question, COVID-19, hindi pa rin natatapos ang ating problema. That's why for this campaign, meron tayong mga karagdagang orientations on infection prevention and control, as well as we provide our health workers with PPEs to protect themselves, their clients, their families, and the community sa COVID-19 transmission. Yung mga health workers kasi natin, vaccinators natin in the field, nagsusupport din po sila sa COVID-19 efforts. That's why for this campaign, nasa plano po ng ating mga regions, ng ating provinces at mga local government unit na may mga karagdagang vaccinators na tinetrain na po sila as early as 2 months ago para sila po yung mag-a-assist as vaccinators in the different local government units kapag isinagawa na po natin yung ating pagbabakuna kontra polio at tigdas sa darating na October 26. So we are not actually decreasing the number of health workers supporting the COVID-19 effort, but we are augmenting our vaccinators from the local government unit. Ang suporta po kasi ng Interagency Task Force ay napaka-importante lalo na po sa ating mga katuwang sa local government units so that they can assist our vaccinators kung saan po magsiset up ng ating mga temporary vaccination post when we do our MROPV campaign in October 2020. Okay, over to you.
We'll move on to the next question from Joe Vicky of Enquire.
Good morning, ma'am. Hello.
Joe Vic.
Yes, ma'am. Hello.
Go ahead po.
Yes, ma'am. Itatanong ko lang. Bakit po natin hindi masabi na controlled na yung polio outbreak? Kasi parang 1 year na din since yung first reported, and to date, ang cases natin is 27. Ano yung metric natin para masabi na controlled na yung outbreak? Hindi ba sapat yung relatively lower number of cases detected. Tapos yung sa presentation nyo kanina, yung 6 years old saka 1 year old sa Pasay na polio cases natin, kailan po ito na-record? And na-trace na ba yung strain kung saan nila possibly nakuha ito? Thank you.
Thank you, Jovic. Okay, regarding the polio outbreak, ang kailangan po nating maunawaan sa polio, ang kaso or yung nakikita natin na nagkaroon ng paralysis dahil sa polio, this will just represent 0.1% of cases of polio infection. Hindi po lahat ng nagkakaroon ng poliovirus sa kanilang katawan, vaccine-derived poliovirus, ay nagkakaroon ng simptomas. Because most of polio infection are asymptomatic. So, ang ibig sabihin nito, kung meron po tayong nakitang isa, ibig sabihin nun, outbreak na kasi sa kabuuan or the entire universe of polio infection, maliit na porsyento lang siya na nakita natin na nagkaroon ng paralysis. Now, regarding stopping or regarding closing the outbreak, it is not the Department of Health who will announce that the polio outbreak has been controlled. There is an assessment team, it's called OBRA, Outbreak Response Assessment Monitoring Team, na pumupunta sa atin, ina-analyze ang ating data, tinitignan ang ating mga datos, tinitignan ang ating mga plano on polio outbreak control, as well as kung ano yung kabuuang plano natin for the global eradication of polio and stopping the outbreak. So, may mga criteria po silang isinet sa atin na kailangan nating ma-meet para nila masabi na close na po yung outbreak sa Pilipinas. And one of these criteria is actually hindi tayo nakakakita ng isolates in the last 6 months. So, makikita din sa isa sa mga criteria na sinabi, mataas na po yung ating kapasidad sa pag-detect ng polio transmission, and I am talking about our AFP surveillance or acute flaccid paralysis surveillance. At ang pangatlo po ay may mga naipapakita tayong ginagawa natin on how to reach the chronically unreached population sa pamamagitan ng pagbabakuna or pagsabi or pagbigay sa kanila ng datos na mataas na po yung ating coverage both sa routine and the supplemental immunization na isinasagawa natin. Alam po naman ninyo na ang ating target ay 95% sa lahat po ng mga bakuna na ibinibigay natin. So, yun po yung sagot ko, hindi po ang Department of Health ang magsasabi na close na po yung outbreak or controlled na po yung outbreak. Subalit, ang isa po ang OBRA assessment team na magre-rekomenda sa Global Polio Eradication Initiative at sa WHO na tayo po ay nakapag-control na ng ating outbreak noong 2019. Sa pangalawang katanungan, yung pong sa Pasay case, iniintay pa rin po natin ang final result na manggagaling po sa ating regional laboratory for polio as well as confirmation from the US CDC. Bagamat kaya nga po ito ay nakabox pa rin ng purple, although in-include ko na po dyan, pero ito po ay i-confirm pa rin po sa ating mga ibang regional laboratories at sa US CDC, this 6 years old from Pasay. Kailan po natin na-discover po ang kaso na ito? Because of our enhanced community surveillance for acute flaccid paralysis, nakita po ang kasong ito last month. Na i-report po ito noong buwan ng Setyembre.
Thank
Over
you,
to
Doc.
you.
Thank you, Doc Wilda. For Greg Gregorio of TV5.
Good morning po. Dr. Vilda, in the past immunization activities, may mga sinasabi po na nakaka-apekto sa coverage ng vaccine yung instances na wala yung magulang sa bahay kapag kababakunahan yung mga bata. Now that in this pandemic, yung mga bata nasa bahay as well as their guardians, do you think mas madaling maabot yung at least 95% target of the population para mabakunahan for both measles, rubella, and the oral polio po?
Thank you for that question. Greg, alam mo kasi, nakita namin yan ngayon ngang sa Bayang Patak kontra Polio na isinagawa natin in 2 regions here in Luzon, in Region 3 and also in 4A. Because of the lockdown, ang sinasabi ng ating mga katuwang sa pagbabakuna sa lokal na pamahalaan, na lockdown sila outside of the province or outside of the region. Hindi sila nakapasok. So, meron kasing mga listahan ang ating mga health workers kung sino po yung mga nakatira sa mga lugar na yon. Meron silang master list, kumbaga. Kaya nga po yun yung karaniwan na nakikita natin dahil wala yung mga bata kasama yung kanilang mga magulang at naabutan ng lockdown sa ibang lugar. Kaya po sila ay wala doon sa kanilang mga tahanan nung isinagawa ang pagbabakuna sa mga rehiyon na napili at sa mga probinsyang napili sa Region 4A. Now, for the measles, rubella, oral polio vaccine supplemental immunization activity in 2020, October 2020, ang atin pong estratehiyang gagamitin ngayon ay fixed post or the modified. Dalawa po. Fixed post, ibig sabihin sa lahat po ng mga health facilities, health centers, barangay health station, sa ating mga ospital, lying-in clinics, no? Yun po yung mga fixed site natin. Bukas po sila pamula alas 8 hanggang alas 5 ng hapon at magsasagawa po ng pagbabakuna, kaya ang atin pong mga vaccinees ay kailangan pong pumunta sa ating mga fixed post or sa ating mga health centers. Another strategy that we will be employing for this 2020 MROPVC is the modified site. By modified site, yung ating mga mobile teams ay magsiset up ng temporary post sa mga strategic locations. For example, sa barangay halls natin o kaya sa isang open area, basketball court or gym, for example, covered gym. At magsasagawa po sila ng pagbabakuna at kung nakapagbakuna sila ng kanilang intended target, kung ilan po yung mga target nila, for example, in one zone, and then lilipat na po sila sa kabilang lugar and set up another temporary post. This is now wala pong door-to-door ngayong pagbabakuna sa Oktubre, no longer door-to-door but a modified fixed post ang ating gagamiting strategiya. So for the problema na absent or wala sa bahay ang ating mga bata or mga chikiting na babakunahan, kaya nga po kami ay nakikipag-ugnayan sa ating mga lokal na mga leaders at our barangay chairpersons and our leaders in the barangay na sana po ay maipakalat na ang ating gagawing supplemental immunization para po masiguro na yung ating mga chikiting ay maidadala sa either sa fixed post or the temporary sites na pagpaplanuhan ng ating vaccinators at ng lokal na pamahalaan, particularly the barangay local government unit, sa darating na pagbabakuna. So I hope maiiwasan natin yung the child is away or the child is not home during this time or during this campaign dahil maganda na po ang pakikipag-ugnayan ng ating mga vaccinators sa ating mga local government units. Thank you, Greg, for that question. Over to you, Dominic.
Thank you, Doc. For the next question, Aiko Miguel of UNTV.
Yes po, Doc Wilda, good morning po. I'd just like to ask for what you said earlier that ina-expect po natin na magkaroon ng big outbreak by 2021. Just like to know ano po yung factors that we are considering or yung basis po natin to say that we expect a big outbreak sa 2021, and if ever na hindi po ma-prevent or if ever hindi po ma-reach yung target for the immunization, ilan po yung mga posibleng maapektuhan nito pong outbreak po na ito? Thank you po.
Okay. In predicting the outbreak, ganito po kasi yung ginagawa natin. May ginagawa po tayo regularly. We call it the routine immunization. We give our infants 2 doses of measles-containing vaccine at 9 months and 12 months. Bawat rehiyon, bawat probinsya, bawat barangay, meron po silang target. Dahil po ito ay base sa ating Philippine Statistical Authority, nakikita natin or meron tayong numero kung ilan po yung naipapanganak at ilan po yung nakakarating sa kanilang first birthday. Ngayon, ito pong target na to, ito po yung kailangan nating mabakunahan for measles. At least 2 doses of measles-containing vaccine. Kung hindi po siya protektado, hindi naka-receive ng isa, at least 1 or at least 2 doses of measles-containing vaccine, we call them susceptible. Ibig sabihin, posible na sila po ay magkaroon ng measles infection. So kung titignan natin ang ating coverage, routine immunization coverage in the past, makikita natin last year, nagtala lang po tayo ng 67% sa ating FIC. Ibig sabihin, yung natitirang mga 23%, yun na po yung ating na-miss. So yung 23%, kino-convert natin yan sa numero. And then we look also at our supplemental immunization activity. Ilan po yung nabakunahan doon sa supplemental immunization activity and the outbreak response immunization na mga isinasagawa ng different regions and provinces. Kung hindi nila nakuha yung kanilang target, then nag-a-add po iyon sa mga numero ng pwedeng magkaroon ng measles infection sa mga susunod na buwan or susunod na taon. Another thing na fina-factor in natin ay yun pong incidence ng measles. Ilan po yung nagkasakit ng tigdas in the community? So, tinitingnan din natin particularly the under 5 kasi kung marami nang nagkasakit ng measles sa under 5, ibig sabihin hindi na po sila magkakasakit ng tigdas sa susunod. So all of these factors are put in the analysis. Nakikita rin po natin dito yung mga papasok na hindi pa bakunado dahil hindi pa siya pwedeng bakunahan kontra tigdas. So itong mga to dumadagdag doon sa tinatawag nating susceptibles. And if the susceptible reach more than half of your target, let's say ang target po natin sa isang taon is 2.1 million children. Kapag ka po ang target natin na ito, more than 50% ang nag-accumulate na mga susceptibles natin for 2019, going back 2018, 2017, then makikita natin na ang posibilidad na magkaroon ng outbreak the following year mataas. So yun po yung ginagawa naming analysis. Nakita natin may outbreak tayo noong 2017. Actually, this was a predicted outbreak in 2017. So as early as 2018, I should say, So as early as 2017, nagpalabas na po kami ng mga outbreak response immunization advisories in the high risk areas. But unfortunately, hindi ho maganda ang ating coverage to successfully stop the measles transmission. So yun yung sagot, Miss Aiko, na ang tinitignan po natin, coverage, number 1, for routine and the supplemental immunization. Pangalawa po ay yung ating tinatawag na immunity from natural immunity, yung mga nagkasakit. Maternal immunity, tinitingnan rin po natin. At tinitingnan rin po natin yung behavior ng ating or yung ating clustering ng measles cases. So kapag lumampas tayo dun sa tinatawag nating threshold ng susceptible, then the probability that the outbreak will happen in the next year or in the next few months, mataas. So that's why we are continually monitoring our measles incidents para nakakapagplano tayo kung saan yung very optimum time, para magsagawa ng preventive immunization campaign. So yun yung gagawin natin sa Oktubre. It's gonna be preventive, hindi tayo outbreak response kasi mababa ang kaso because we want to prevent the outbreak by next year. Over to you.
Thank you, Dr. Wilda. Last 2 questions po. We have Christine Sabilio.
Doc, I wanted to ask, you mentioned kanina yung about pag wala ng isolates in the last 6 months, it means na na-control na yung outbreak. What does isolates mean? How would we measure that? And then my second question would be, could we say that it's a possibility that the only thing that's stopping a full-blown outbreak right now is that children are indoors?
Thank you, Christine. Okay, the isolates. Before I can discuss the isolates, let me tell you about our surveillance for polio. We have acute flaccid paralysis surveillance and we have environmental surveillance. First, let's discuss environmental surveillance. Sa environmental surveillance, may mga piling sites tayo. We have selected sites na nagtetest po tayo ng water on a regular basis, monthly. Tinetest po natin yan for vaccine-derived poliovirus or even wild-type poliovirus. But I'm happy to inform you that in the Philippines, we have eradicated the 3 wild types of polioviruses already. So yung isolates na sinasabi natin sa environment, tinetest po yan, may mga piling lugar, monthly basis ang pagkolekta ng sample, tinetest sa RITM. So patuloy po ito kasi ito po yung counterpart ng ating acute flaccid paralysis surveillance. By acute flaccid paralysis surveillance, isolates naman po ito sa human samples. So yung acute flaccid paralysis po kasi, lahat po ng mga bata under 15 years old na nagkaroon ng sudden onset of weakness of one or both extremities, lower extremities, napunta po yan sa hospital. Not necessarily polio, but we call it acute flaccid paralysis. So, lahat po ng causes ng acute flaccid paralysis, kailangan kuhanan ng stool sample. Hindi not necessarily na sasabihin mo na kaagad na this is polio because you have a lot of causes of acute flaccid paralysis. 1 is trauma. 2 is if you have very low potassium in your body, no? Yung mga yon, pwedeng magbigay sa'yo ng ganitong simptomas na bigla kang hindi makalakad kasi nang hina ang iyong mga lower extremities. So, ito yung tinitignan natin sa ating mga hospitals, sa ating communities. Now, Kung nag-positive siya sa polio, then that is a positive sample at marereport na po yan sa ating database. And I hope I answered your question regarding isolates. This is a regular activity na polios under the polio surveillance para makita natin na indeed wala na pong nagkakaroon ng polio sa atin at wala na pong polio transmission na nangyayari. Now, for your second question, kung makokontrol ba ang outbreak because children now are indoors, actually nakatulong po iyan. Dahil sa limited movement, as I have mentioned earlier, the limited mobility of the population, na-decrease din po yung ating transmission ng mga vaccine-preventable diseases. And since everybody is wearing masks, no? And conscious about hand washing already. So, yung transmission ng ating mga vaccine preventable diseases medyo bumaba ng bahagya. But then these are added strategies to control transmission of not just COVID but also other infectious diseases. Kailangan pa rin po ng pagbabakuna because if you don't get the protection from the vaccine, hindi tayo makikipagsapalaran na you get the protection from getting the disease, no? Kasi sabi nga natin kapag nakakuha ka na ng measles, immune ka na. But the risk of getting complications because of measles and the risk of dying is there. Yun yung ayaw nating mangyari. So, my answer is, even though the children are at home, hindi sila nakakalabas, still they need to be protected from vaccine-preventable diseases. Because, as I have been saying time and again, our viruses know no boundary. So, papasok sila where they can see a gap, and we want to close that gap so that we can protect the entire community and we save children from dying because of vaccine preventable diseases. Over to you.
Thank you, Doc Wilda. Last question po from Caroline Bongkin of CNN Philippines. She asked, gaano pa rin po ka-hesitant ang parents sa immunization program ngayon compared in the past 2 years when the trust in vaccines went down due to the Denvaxia issue? Nag-improve na po ba?
Thank you for that question. I would like to think na bumabalik na po ang tiwala ng ating mga mothers and caregivers, parents, lolo, lola sa pagbabakuna. You know, the measles outbreak in 2018 and 2019, kung saan nagkaroon tayo ng more than 100% coverage sa ating nabakunahan, nag-exceed tayo sa target actually. And this brought down the measles incidence very low. Ito po yung proof na bumabalik na po. But what I would like to point out is, sana po is tuluyan nang bumalik ang kanilang tiwala, their trust in the DOH vaccination program, their trust in the vaccination program in general. Dahil po ayaw natin yung nangyari noong 2018 at 2019 na nagkaroon tayo ng mahigit sa 600 na bata under 5 years old na namatay dahil sa tigdas. Sana po ay hindi dahil sa takot kaya sila ay nagpabakuna laban sa tigdas in 2018 and 2019. But because of what we are doing right now, we are reaching out to our community. Pinapaalam natin ang importansya ng bakuna. You know, I hope and I would like to believe that slowly their trust in the vaccination program is coming back. And I would also like to add na sana po ang ating mga partners, you, our partners in the media, kayo po ang aming boses sa pagbibigay ng tamang impormasyon, timely information, correct information about vaccination and about other DOH programs, health programs para po sa kalusugan ng sambayanang Pilipino. Over to you, Dominic.
Thank you, Dr. Welda, for sharing your time and expertise with us. Those are all the questions we can accommodate related to the topic. Again, Dr. Welda, maraming salamat po. Yusek Cruzet.
Maraming salamat, Wilda. Thank you for all the information and for answering the questions of our media partners. So good morning again to all of you. Welcome to our regular media forum. So bago po ako mag-umpisa, I'd just like to give an update, no, base sa mga activities na ginagawa ni Secretary Francisco T. Duque III. So official nagsimula po kahapon yung 71st session ng World Health Organization Regional Committee in the Western Pacific region. Ang atin pong Secretary of Health ay nahalal bilang chairperson ng governing body na ito ng WHO sa Western Pacific region. Pangunahan po ng ating Secretary Francisco T. Duque III ang discussions patungkol sa mga susunod na usapin. Unang-una, of course, COVID-19. The second would be vaccine preventable diseases and immunization. The third would be aging and health. And the fourth would be safe and affordable surgical interventions. And of course, the program budget for 2022 to 2023. Ang WHO Regional Committee in the Western Pacific region ay binubuo po ng mga kinatawan ng 37 member states in the region as well as their associate representatives. Sila po ay nagko-convene every year to formulate policies, provide oversight for regional programs, report on their projects, and consider, revise, and endorse new initiatives. So the resolutions and decisions adopted during the session will guide the work of the regional and country offices for the following year, which is 2021. So that is just an update coming from the activities of the Secretary of Health. Nick, we can start our media forum already.
Thank you, Yusek. We have a few questions related to the COA. I will read po the first question of Gerald Naval Malaya. May we get the statement po on the COA's report that 2.2 billion worth of drugs, medicines, and other supplies in its inventory are either expired, nearly expired, or overstocked and slow moving. Also, he asked, in the same report, COA denoted that PhilHealth denied government hospitals of some 100.15 million in reimbursement claims due to their failure to comply with the reimbursement regulations. What would be its effect on the budget of the concerned public hospitals?
Nick?
Yes, ma'am. Yusek?
Nick, sorry.
Go ahead, Yusek. We can hear you na po.
Okay, sige. First, I would like to, ito kasi since yesterday, marami na ang naghihingi sa atin ng statements regarding this matter. Of course, the Department of Health would issue an official press release regarding this matter later, no? Pero ang gusto lang ho nating klaruhin, unang-una, ito pong report ng Commission on Audit, ito pong kanilang CAR ang tawag dyan. Ano? This only covers the period of January to December of 2019. So ito po yung mga procurement, mga nasa warehouse noong 2019, and this is part of their work. No? And kaisa po kami ng Commission on Audit para magkaroon ng efficiency ng resources ng gobyerno. Ngunit gusto lang po namin klaruhin. Ano? So unang-una po, ito pong ating mga sinabing 2.2 billion worth of commodities, katulad ng sabi ko, ito po ay from January to December of 2019. Sa kasalukuyan po, nakapag-distribute na po tayo ng lahat ng near expiring medicines amounting to more than 1 billion pesos. Kasama po yan doon sa report nila, na nailabas nila na meron po tayong mga near expiring medications na hindi pa na-distribute. So lahat po yan, we were able to distribute already from January to August of 2020. Ongoing pa rin po yung distribution ng ibang mga natitirang commodities sa aming warehouse. So meron ho silang binanggit dito na tinitignan ko lang para klaro tayo, na 1.1 billion overstock or slow-moving commodity. So base po sa aming datos, ito po ay na-distribute na from January to August also. Ang natitira po ditong commodities is 322 million na lang po, and ongoing pa rin po ang distribution namin. Kasama po yan dun sa aming schedules until the end of the year. So sa central office naman po, yung sinasabi na nag-expire, meron ho tayong sinasabi na expired commodities, no, na meron din worth na nilagay dyan sa article na yan. Ito po yung mga dental kits na tinatawag. And these dental kits were procured and we were already able to distribute 98.6% of these dental kits. Ito rin pong dental kits na naiwan, 840 kits na lang po ito. At ang laman po nito ay mga toothbrush at saka mga sabon, no, na hindi naman sila talaga mag-expire. Meron lang ho tayong fluoride na nasa loob niyan. As we have said, we only have 840. And this is also set for distribution already to our facilities. So gusto lang ho namin maklaro lang po ito, no? And also, of course, ang Department of Health naman, hindi naman po natin kinakaila, no, na meron ho talaga tayong mga naging challenges sa aming distribution, sa logistics, sa warehousing. Kaya nga po, nag-set ng mga reforma po si Secretary Duque, no? Nagbuo siya ng specific office which is in charge of logistics and management dito po sa DOH. Dati po, wala kaming ganyan. Pangalawa po, kami po ay umaasa, no, that with this Universal Healthcare Law and Mandanas ruling, mababawasan po yung pagpo-procure ng mga gamot dahil sa Mandanas ruling, we will be providing the budget to the local governments already for them to be able to procure para sa kanilang mga kababayan. Ano? And with UHC naman, we are now on to that direction where there would be population and individual-based services kung saan magkakaroon na ng mas rational na procurement po, no, na ibig sabihin, yun pong mga population-based services na lang ang ipoprocure ng ating national government, and the individual-based services will be reimbursed na lang based from the procurement of each facility. So gusto lang ho namin klaruhin uli, itong report na ito ay base sa monitoring and audit that has been done by the Commission on Audit from January to December of 2019. And we are saying that kaisa po kami ng COA, no? That is part of their mandate na gumawa nitong mga CAR, and we are closely working with them and cooperating dun po sa mga hinihingi mga dokumento at mga datos na amin pong naibigay sa inyong lahat ngayon. Nick?
Thank you, ma'am. Moving on to the next question, we have Joe Vicky of Enquire. He asked, under WHO's guidance on school openings, areas where there are sporadic or no cases may resume classes provided that health protocols are observed. Is DOH inclined to recommend to DepEd to resume face-to-face classes, particularly in provinces where there are few to no reported COVID-19 cases, as similarly suggested by the Vice President Robredo? How many provinces currently fit this criteria?
We agree, no, with unang-una dito po sa ating sitwasyon ngayon with this pandemic, no. Kaya nga po yun pong distance learning na tinatawag, yan po talaga yung ipinapatupad so that we can minimize face-to-face interaction. Hindi po tayo magkaroon muna ng risk, especially for the children, ano, to acquire the infection. But of course, eventually, we would like that we will be shifting more into this normal or routine na ginagawa natin, ano, nagkakaroon din po ng face-to-face classes at ma-resume yan. Sa ngayon po, ang atin pong napagkasunduan at iyan din po naman ang naging resolution sa IATF would be this blended learning muna, no? And this would include mostly these platforms na pwedeng gamitin ng mga mag-aaral para dito sa distance learning na ito. Actually, nakikita natin ngayon kung paano yung efforts ng Department of Education, no, to really expand, no, itong mga avenues where students can access, no, itong mga modules, itong mga pag-aaral. Meron na sila sa TV, meron sila sa radio broadcast, at iba pa hong platforms na naisasagawa natin sa ngayon. Ito naman po ay magkakaroon din ng analysis, no? Just like with any program na inilulunsad ng gobyerno, nagkakaroon po yan ng monitoring and analysis after a few months para makita natin how effective it is. And hopefully, in the coming months, as I've said, pag dumating na po tayo dun sa point na yung risk to health, para especially for our kids and the teachers, would be lessened and would just be minimal, baka po dadating tayo dyan sa pagdedesisyon ng IATF that face-to-face learning can already be resumed. Okay?
Thank you, Yusek. Next question po. May we ask for further clarification on how the government uses the attack rate indicator? Is there a particular percentage threshold that LGU should maintain and hold for X number of days for officials to say that the outbreak in their community?
Okay, ang average daily attack rate, ang tawag natin dito yung ADAR, no? Ito is a measure of risk. This is a measure of risk of being infected. So ito yung probabilidad na ang isang tao ay magiging may sakit o mahahawa sa sakit at they would be ill within a defined population and a time period, no? So kinukuha natin ito by getting the average number of new cases per day in a specific area within a 2-week period over the population of the area. So once we have that, na-compute na natin yon, minumultiply natin ito sa 100,000 kasi ang sabi natin, ang average daily attack rate would be the number of cases per 100,000 population. So mas mataas ang average daily attack rate would be higher, meaning there is higher risk of infection in that specific area. So kung, for example, meron tayong average daily attack rate na 50 per 100,000 population, that means 50 people are likely to get infected per day, no? For every 100,000 population in that specific area. So mas mataas po yung average daily attack rate, mas mataas din po ang tinitignan natin na risk of infection dun sa area na yon. So ang ating benchmark para masabi natin na tayo ay well within that space na manageable is we will have an average daily attack rate or ADAR of less than 1 per 100,000. Yan yung ideal na benchmark, no? So meaning dapat ang mga probinsya natin na minomonitor natin, yung ADAR natin, dadating tayo dun sa point na less than 1 na lang siya per 100,000 population. Ibig sabihin, yung risk of being infected in that area is below 1 and it's very, very minimal and so it is already manageable. Nick?
Thank you, Yusek. From Caroline Bongkin of CNN Philippines, she asked, where is the Philippines now in satisfying the criteria for countries which will host the WHO Solidarity Trial for vaccines? This includes preparedness to conduct trial, availability of experts and investigators, and a vaccine trial committee.
Yes, actually tayo ay nakapag-fulfill na nitong mga sinasabing mga kondisyon ng WHO para maumpisahan natin ang clinical trial dito sa ating bansa. Unang-una yung preparedness to conduct trial, meron na po tayong proponent at sila po ay nakapag-submit na rin at naaprubahan na ang ating clinical trial protocol. And coming from the UPPGH po ang ating proponent, si Dr. Hodor Lim. Pangalawa, yun pong mga sites ay na-identify na together with WHO. Yan pinag-aralan po. May criteria po tayong isinet kung anong mga sites ang isasama natin for this clinical trial process, no? Pangatlo, we are already starting to engage the local government units. Alam po natin na kailangan nating immobilize at i-engage ang local governments. So the Department of Science and Technology and the DILG already entered into this Memorandum of Agreement para nakasaad dyan kung ano ang mga responsibilidad ng bawat ahensya as well as for the LGUs as well. Ang susunod naman po, yung engaging the community. So we are now preparing, we are now planning kung paano tayo mag-engage ng community through our Health Promotion Bureau, no? So napaka-importante po that we engage the community so that the community will be informed of this trial that will happen, what would be the advantages, what would be the possible na disadvantages or harmful effects, no, of this vaccine and how it can benefit the community. So lahat ng ito po ay pinaghahandaan natin sa ngayon. As to the experts, as we say, we have our vaccine experts panel. But aside from that, we are now trying to create, no, the Data Safety Monitoring Committee. Ito po yung sa monitoring ng pagbabakuna para meron tayong mga eksperto para po pag sinabmit sa kanila yung data, they can readily analyze and provide further recommendations to the implementers, no, sa Department of Health at saka po sa mga local government units. So lahat ng po ito ay tayo po ay nagpe-prepare na, as we say, as we wait for WHO, no, to announce the trial sites, to announce when really the start of the clinical trial. In parallel, we have started, no, and we are finalizing actually our preparatory activities already, so that when WHO signals, no, na mag-uumpisa na po tayo, we are already ready for these trials.
Thank you, ma'am. Also from Caroline Bonkin, she asked, the WHO warned that the public's mental health has been overlooked in the crisis due to disruption in services and budget cuts. In the past, the DOH only had less than 3% of its budget for mental health services. And this year, the budget for mental health faced cuts based on the NEP approved by DBM versus 2020 budget. May we ask for the DOH comment on this?
Yes, Caroline, no, our budget last year was at 201 million. And in 2021, we have proposed for a higher budget, but unfortunately, we were not approved, no, itong ating second year para dito sa budget namin. So for this year, we have 234 million na budget para sa mental health. Itong ating budget for mental health usually through the years, no, we procure medicines, no, kasi meron tayong mga medicine access sites kung saan pwedeng kumuha ng mga gamot ang ating mga kababayan na merong mga ganitong may mga ganitong sakit, no. Aside from that, we also provide budget para dun sa mga advocacy campaigns natin sa iba't ibang areas natin para masusugan natin yung impormasyon ng tao na there is this thing called mental health, no? Marami sa ating mga kababayan hindi nila naiintindihan, akala nila lagi it's just always physical health, no? But there are really issues confronting us, especially now when it comes to mental health. Aside from that, we also have developed these hotlines for mental health. Dati po yung nasa NCMH natin na hotline ay ang minamanage niyan at it is being provided assistance, no, by an NGO. Ngayon po tayo na po mismo ang nagmamanage at saka nag-ooperate nito. So meron din po tayong budget na ginugugol dito dahil marami po tayong hinahire para maman itong ating mga hotlines para makapagbigay tayo ng tulong 24/7 sa ating mga kababayan. Tayo rin po ay may nalalapit na Mental Health Awareness Month, no? Ito pong October actually, we celebrate the Mental Health Awareness Month. And dito po nagkakaroon po rin po tayo ng mga iba't ibang mga activities so that we can be able to advocate for the mental health of people, no? Sa across the country. So meron ho din tayong mga ganitong activities for this month. And as I've said, ito pong sa access sites natin ng mga gamot, atin din pong sinusuri ngayon. Ito pong mga listahan na gamot, no, na ipamimigay natin kung ano po ang mga kailangan pa. So we have regular coordination also with experts in the field. No, we have this working group with experts for mental health. Meron ho tayong national group dito na pinamumunuan ng Secretary of Health. Tas meron ho tayong mga experts na kasama dyan kung saan meron po tayong strategic plan na ginagawa, meron din po tayong mga pag-aaral kung ano po yung mga what's working and what's not working with the program and what should be done in the future. So lahat ng ito po ay ginagawa natin ngayon, recognizing how important the mental health program is for the Department of Health and of course for the population. Nick?
Thank you, ma'am. For the last question po for today, we have Gaia Cabico of the Philippine Star. Is the DOH planning to tie up with privately owned cold storage facilities for vaccine storage?
Ito po ay pinag-aaralan. Actually ngayon, ang sinasagawa ng Department of Health, dahil alam na nga po natin, I'm sorry I failed to mention this kay Carolina question. Kasama po yan sa pagpe-prepare natin para dito sa mga trials, para dito sa mga darating na pagbabakuna, na dapat meron tayong appropriate and adequate na storage para sa mga bakuna. Alam po natin na lahat po ng bakuna na darating, may mga iba't ibang requirement for storing. Meron yung iba less than 20, yung iba less than 80 pa, yung iba naman 4 to 8 degrees pwede na. So iba't ibang klaseng bakuna, iba't ibang klaseng storage requirements. So ang isagawa na po natin ngayon na pag-utos na, tinignan na po ng ating mga logistics management group yung kapasidad. Ano ang current inventory na nakalagay dun sa mga cold storage facilities namin, gaano pa kalaki ang available para po makapag-store tayo ng mga bakuna, at ano pa ho ang kailangan natin further, and forecasting kung gaano kadami itong mga darating sa atin. Aside from that, hindi lang dapat yung warehouse or the cold storage facility ang atin tinitignan. Kailangan natin tignan yung distribution process natin, kung gaano tayo mas mapapabilis ma-distribute agad, because we're not just talking about Metro Manila. May tinitignan pa rin ho tayo mga iba't ibang rehiyon na pagdadala ng mga bakunang to. So ito pong lahat ay tinitignan ng kabuuan, atin pong pag-aaralan, at of course, yun pong bukas ang ating tanggapan, na andyan po yung posibilidad na baka magkaroon tayo ng partnership with a private warehouse or logistics management team para po mas maisaayos natin, because we know critical po ang pag-store ng bakuna na ito at pag-distribute ng mga bakunang ito. Nick?
Thank you po, Yusek. For all the questions that are submitted on the chat box, we will collate all the questions and send the answers via Viber. Yusek, your final message po before we end today's forum.
Okay, so nais lang po namin magpasalamat sa inyong lahat for today, and of course for your usual support. So gusto rin po namin magpasalamat kay Dr. Wilda sa pagpapaunlak at saka nakapagbigay siya ng maraming impormasyon sa inyong lahat, mahalagang updates sa mga events na darating para sa programa. Makikita natin ang kagandahan o kahandaan ng programa upang bigyan ng angkop na proteksyon ang mga bata sa pagbabakuna, lalong-lalo na po ngayon na may pandemya tayo. Isa po sa mga pinag-iigting na primary care service ng gobyerno ngayong COVID-19 ay ang pagbabakuna dahil sa kahalagahan nito sa pagbibigay ng proteksyon sa ating mga kabataan. Nagbago man po ang daloy ng mga nangyayari sa ating paligid dahil sa sitwasyon natin, hindi po ito dapat hadlang para tumigil ang mga importanteng serbisyo, lalong-lalo na po ang immunization. Ang pagbabakuna po sa bata ay pangmalawakang depensa laban sa mga nakakahawa at malulubhang sakit na maaring magdulot ng pagkamatay, kapansanan at outbreaks kagaya ng COVID-19. Marami na pong pag-aaral at clinical trials na sumuporta sa bisa ng mga bakuna gaya ng measles, mumps, rubella or yung MMR, polio at iba pa hong mga bakuna na dati na po nating ibinibigay sa ating mga kabataan. Sa ngayon po, mas naghahanda po ang ating mga health centers, ang ating mga health facilities, ang ating pong mga community workers, katuwang po ang ating local governments na ihatid sa ating communities ang pinakamahalagang proteksyon para sa ating komunidad. Tayo po ay nakikipag-ugnayan sa kanila dahil libre lamang po ito. Wala pong bayad, ang pagbabakuna, libre pong ibinibigay ng ating gobyerno ito sa lahat ng ating mga kabataan, pati na rin po sa ating mga nakakatanda. So ang pagkakaroon po ng mabisang proteksyon laban sa mga sakit na ito ay kasama po sa mandato ng national government through the Department of Health. So sana po matulungan nyo kaming ma-disseminate itong impormasyon na ito kung gaano kahalaga ang bakuna para sa ating mga kabataan. So again, thank you very much to all of you. We will see you on Friday for our regular media forum. So maraming salamat, and Nick, thank you.
Thank you po, Yusek. Thank you po to other media.